Hello everyone, it's Rance with Straight Advice, and today's topic will be nursing care and adult homes. And this pertains to your loved ones, your mother, your father, your aunt, maybe your grandparents when they're suffering from dementia or Alzheimer's and they can no longer care for themselves. So you have to find a place for them where they can receive the care that they're entitled to and they should have. So first off, this advice comes from me. I have the experience. I've gone through this. It's very difficult and challenging, but you will be able to navigate it and get through it. And don't worry, have no fear, and hopefully this little talk today will help you a little bit, give you a little advice that I didn't have at the time, but hopefully it will help you. So first off, what you will need, you have to consider this, is the cost of whether it would be an adult home or whether it would be a nursing care facility. So hopefully your family member may have private insurance to cover the costs. So that's the first thing you need to look into. And if not, you're going to need Medicaid. Or if they're a veteran who is honorably discharged, they may have benefits from the VA that would help with the costs. You need to look into that as well. Look for a DD-214. It's a military jargon for a discharge paper. It's like a syllabus that covers everything they did and the type of discharge they had when they left the military. It's a very important document. So the first thing is getting Medicaid. Medicare is different. Medicare would cover the first 20 days of nursing care, and that's it. And you will need Medicaid if you don't have private insurance or the VA or an awful lot of money. The cost per month, typically where I live here in the state of Washington, is between $4,000 and $8,000 a month for a decent nursing home, which is certainly what you want. The adult homes, not a big fan of the adult homes. I know I'll probably hear some criticism about this. I know there's probably some great adult homes. I went and did a lot of homework before I found a place for my mother, and the adult homes I really didn't have a good feeling about them. The ones that I went and saw, I felt like they were pretty sketchy, and there wasn't really any oversight on these homes, and who knows what may or may not go on, behind those walls. So for me personally, it wasn't an option for my mother. It was probably more affordable, but it wasn't going to happen. So there are some things you can do online. You can look at like Medicare.gov will have listings for nursing homes in your community. There should be ratings. There's some nonprofits that do ratings on nursing care facilities. You want to look at those first. That's what I did. And you want to get a list and then make it a short list. Go off of the reviews first. Then you want to go and see the nursing homes, nursing care facilities, and you want to inspect them. And you don't want to make an appointment where they know you're showing up. You want to just drop in, walk through it, ask some questions, talk to some people. Hopefully there'll be some family members there visiting their loved ones, and you can talk to them too, because they're going to be very honest with you. And go with your gut once you do these inspections. If you have any feeling at all that it's just something's not quite right, it doesn't feel like a really good place for your loved one, then by all means just keep looking. Now, if you're in another facility or a hospital with your loved one is there, you may get pressure from them to hurry up and get your loved one into a nursing care facility. In my case, my mother was in a hospital locally. I got her in, thank God, from assisted living to a hospital which dealt with people that had dementia and Alzheimer's. And I was able to get her some care there while I was transitioning to a nursing home. And they put a lot of pressure on me to hurry up because they wanted that bed space, and pushed really hard. And I spoke to a social worker, and she told me to not worry about their pressure tactics and to make sure that I was comfortable. So I want to tell you that as well. Don't let people pressure you or push you into placing your loved one in a facility that you don't feel good about. That's your call. You'll have, I'm hoping you'll have a POA or a guardianship at this point. You'll need that. And check my earlier video on that if you have any questions about that. And then go and find a really great facility, because it's so important to have a good facility for your loved one. You don't want to just drop them off at the closest one or the most affordable one. So if you have any other questions or comments, please place them below. And if you feel like the video's helped you, please like it. And I hope this little bit of advice has been helpful for you. And I know it's a difficult and stressful process that you're going through, and you will get through it. I can tell you that right now. As hard as it is, you're going to get through this. Just take it one step at a time. There are people that are out there that are there to help you. Social workers and some nurses, and you can check for some nonprofits in your community. And I hope that you have a wonderful day. And thank you.